Dear colleagues, welcome to day 5 of ASCO 24. We proudly bring you this Oncoalert roundup of day 4, which gave us an exciting day for GU cancers and breast cancer. Please note that these are just some of our picks, and if you would like to dive deeper into these trials, sign up for the newsletter in the link found in this post, or sign up at www.oncoalert360.com. That's www.oncoalert360.com. We will be coming out with our complete wrap-up newsletter in a few days, so you can go ahead and sign up for that. And of course, if you have friends that are not signed up, please let them know. Taking the opportunity to thank our friends and collaborators at the American Society of Clinical Oncology for such an amazing congress and for all their hard work and dedications. So kudos, ASCO. Now on to the science. EV302 demonstrated that enfortumab vedotin and pembrolizumab significantly improved progression-free survival and overall survival compared to platinum-based chemotherapy in the first-line treatment of locally advanced or metastatic urothelial carcinoma. In the final analysis of the Javelin Renal 101 trial comparing avelumab plus axitinib versus sunitinib in advanced renal cell carcinoma, demonstrated longer progression-free survival with the former, though overall survival differences did not reach statistical significance, affirming its long-term efficacy and manageable safety profiles. In the CheckMate 901 trial, the combination of nivolumab and gemcitabine cisplatin demonstrated significant improvements in overall survival and progression-free survival, particularly in patients with lymph node-only metastatic urothelial carcinoma, affirming its efficacy as a first-line treatment option. Moving on to breast cancer, the ABRAVE trial evaluated adjuvant avelumab versus observation in high-risk early triple-negative breast cancer patients, finding no significant improvement in disease-free survival, but a significant improvement in overall survival with avelumab. The I-SPY trial. This analysis aimed to assess molecular similarities between hormone receptor positive and HER2 negative breast cancers classified as HIE2 by the MammaPrint assay, revealing that HR-positive MP HIE2 tumors closely resemble triple-negative breast cancers in both molecular and clinical features, potentially impacting treatment strategies. The responder trial suggests that AMH levels may be a better way to decide if premenopausal women with specific breast cancer benefit from adding chemotherapy to hormone therapy. The study found that for premenopausal women with AMH levels at or above 10 picograms per milliliters, adding chemotherapy to hormone therapy significantly improved survival compared to hormone therapy alone. In contrast, women with AMH levels below 10 picograms per milliliter didn't seem to benefit from chemotherapy. This suggests AMH may be a more precise indicator of who benefits from chemotherapy than simply age or a woman's self-reported menopausal status. The PEARLY trial shows adding carboplatin to standard chemotherapy improves event-free survival in early-stage triple-negative breast cancer, demonstrates that incorporating carboplatin in standard chemotherapy significantly improves event-free survival and other outcomes in patients with early-stage triple-negative breast cancer. With a manageable safety profile, these findings suggest that carboplatin may become a new standard treatment option for this aggressive form of breast cancer. HR status and BRCA. Hormone receptor status may not predict survival in young BRCA mutation breast cancer patients, but it influences recurrence patterns requiring personalized treatment plans. Ending up with GI, the early-stage Hercules 3 trial investigated the safety and efficacy of combining ARIS-007, a novel ERK inhibitor, with encorafenib and cetuximab, which targets different points in the same pathway. The combination appeared safe and well-tolerated with manageable side effects. Importantly, in the initial group of patients who had not previously received EC treatment, the treatment showed promising effectiveness with a 40% response rate. These early findings suggest that this combination therapy warrants further investigation as potential new treatment options for BRAF V600E metastatic colorectal cancer. And there you have it, folks, your day 4 roundup. Wishing you a great final day at ASCO 24. And don't forget to join the newsletter for the final curated newsletter of ASCO 24 with all the great trials we have discussed in the last days. We thank you very much for your support, and we thank you all for being Oncoalert.